This is Raj and my topic of presentation is rabies. So, rabies is a viral zoonotic disease responsible for an estimated 59,000 human deaths every year. Rabies is always fatal once clinical signs appear as a result of acute progressive encephalitis. Rabies occurs mainly in underserved populations, both rural and urban, and has been documented for more than 4,000 years. Most cases occur in Africa and Asia, with approximately 40% of cases in children aged less than 15 years. All mammals are susceptible to infection by rabies. Transmission of rabies virus by dogs is responsible for up to 99% of human rabies, and with a small proportion due to transmission via wildlife such as foxes, wolves, jackals, bats, raccoons, skunks, or mongoose. Rabies cases in the United States are rare and often caused by a bad strain of the virus. So, rabies is caused by a single-stranded RNA virus, belongs to Lyssavirus genus. The virus is enveloped, non-segmented, bullet-shaped, and has helical symmetry. The size of the virus is 50 to 95 nanometer by 130 to 389 nanometer. Symptomatic rabid animals will have virus in their saliva and nerves. A bite from the infected animal can be, but not always, the route of infection. It is important to know the behavior of the animal, as most of the time an infected rabid animal will be very aggressive and may attack without provocation. The animal will also show hydrophobia and other uncharacteristic behavior. This is an example of how a viral pathogen transfers to the other host by modifying the behavior of the host. Human-to-human transfer of rabies is uncommon and only recorded through transplant surgery. There are documented cases of rabies transferred from one human to another through corneal transplantation and solid organ transplantation. It is also possible that humans can transfer virus through bite, but no case like this has seen so far, as infected humans are usually hospitalized, where they are treated with necessary precautions. The virus entered the peripheral nervous system after replication in muscle at the site of bite received from rabid animal. After that, the virus will start traveling toward the central nervous system through afferent nerves. So the farther the bite away from the brain, the longer virus take to spread. This is the only phase where rabies can be treated through vaccination before it becomes symptomatic. But that virus cannot be easily detected in the host. After the virus reaches the brain, it causes encephalitis, which is the beginning of symptomatic rabies, and no treatment is effective after the rabies becomes symptomatic, and mortality rate is above 99%. Now the signs and symptoms. In humans, the incubation period of rabies is roughly around 1 to 3 months, but there are documented cases of incubation period as short as 4 days and as long as 6 years. Incubation period of rabies depends upon the location and severity of the bite and viral load introduced. Initially, non-specific signs like fever and headache will appear. After the virus reaches the brain, the infected person will show signs of agitation, insomnia, partial paralysis, hallucination, and coma. The classical sign of rabies is hydrophobia. In the later stages of infection, increased production of saliva is seen and patient will have difficulty in swallowing and will panic when presented with water. This shows that virus is being produced and assimilated in salivary glands and is ready to further transmission through biting. Hydrophobia is commonly seen in patients showing furious rabies, which affects 80% of people infected by rabies. Paralytic rabies will be experienced by the remaining 20%, which shows the symptoms of paralysis, muscle weakness, and loss of sensation. It does not show commonly a hydrophobia sign. Even with administration of intensive proper care, the survival rate is rare once the infected person shows the symptoms of rabies, and in 2 to 10 days, death will occur. Now, the diagnosis. It is difficult to diagnose rabies in early stages as the early signs and symptoms of the disease are easily confused with other diseases. FA staining and PCR techniques can be used for the diagnosis. Reliable, reliable diagnosis can be made if the Negri bodies are seen in the hippocampus region of brain samples taken after the death, and diagnosis is made post-mortem in 80% of cases. Diagnosis can also be made through body fluids, but this is not as reliable as brain samples. The animal from which bite is received can also be examined for the rabies in order to diagnose the disease. Now the treatment. Rabies can be prevented if treatment after the exposure administered promptly. Wounds should wash with water and soap for 5 minutes. Follow with alcohol and povidone iodine will reduce the amount of viral load received. Vaccination should be administered, which includes passive immunization with anti-rabies immunoglobulin and active immunization with rabies vaccine. The vaccination and pre-exposure prophylaxis are ways to save the infected person before the symptoms of rabies occur, but there is no effective treatment once the individual has shown clinical symptoms. Now the prevention. Before the development of rabies vaccine, almost all the cases of rabies were fatal. Bureau of Communicable Disease Control and Prevention recommends the vaccination of pet animals against rabies and keep them under supervision. Wild and stray animals should not be handled, and Department of Animal Control should be contacted if such an animal is seen showing strange and aggressive behavior. If an individual is bitten by an animal, the side of bite should be washed with soap and water for a few minutes, and hospitals should be contacted to determine if post-exposure prophylaxis is required. Now the question number 1. Rabies virus belongs to which genus? Number 1, enterovirus genus. Number 2, genus rhinovirus. Number 3, genus lysovirus. And the answer is number 3, genus lysovirus. Question number 2. In which scenario will we see the onset of rabies faster after getting bitten by a rabid animal? Number 1, bitten on the shoulder. Number 2, bitten on the leg. Number 3, it does not depend on the side of bite. And the answer is number 1, bitten on the shoulder. Question number 3. Presence of virus in body fluids is most reliable way to diagnose rabies. True or false? And the answer is 2, it is false. Question number 4. The following are the symptoms of rabies except number 1, hydrophobia. Number 2, difficulty in swallowing. Number 3, aggressiveness. And number 4, blindness. And the answer is number 4, blindness. And question number 5. Negri bodies will be seen in the muscles of an individual infected by rabies. True or false? And the answer is false. Thank you.